We asked the 999 operator what happens when calls come in to prioritise and triage them. Then we asked if the questions they asked follow a preset format.
So our role here would involve the emergency calls coming in and answering the calls and triaging to the best of our ability, so then it is sent across to dispatch and the patient will get an emergency ambulance if necessary.
Yeah, so we take the 999 calls from members of the public, and we basically extract the information from the calls, take them through a set of questions, give them instructions if necessary, and arrange the ambulances for them based on the information that we're given. So obviously it's quite an important role because it's sort of the first port of call, if that makes sense. So then you have to triage them and make sure you get all the right information to get them the most appropriate response. The most serious calls we get are patients who are unconscious, patients with like severe breathing difficulties, and we have different protocols that we use so that we can fit each situation that we take on. So for example, if you're dealing with a more serious call such as unconscious patient, then there are sort of less questions involved, and then it kind of goes straight onto the instructions that you give so that we can maintain their airways and check their breathing. So it varies on the severity of the call, the amount of questions that we get and the amount of instructions we have to give. So we have ProQA, which they explain to you what's happened, and there's 31 protocols, and you basically determine, we have priority symptoms. So for example, symptoms like chest pain or breathing difficulties, if they mention one of those, then it's likely that we need to go down one of those protocols, and then it provides you with a set of questions that you need to ask. So you're basically told what to do, which is helpful, and then you just take that information, it generates the code, and then it goes on like that.